So I'm going to take a moment because I'm sure the entrepreneurs in the crowd are just hoping to get a couple pieces of advice from people who are sitting perhaps in an account or with an organization that you're trying to, get in front of. Just rapid fire before we go to some questions from the floor. Advice to the entrepreneurial community about, interventions, ideas that are coming to you, and it could be a product, a service, a technology. And I will say that what I think is really great about the example that Justin gave in counter to my skepticism associated with whether or not passive data could be used is this idea of empowering and enhancing the clinical encounter and providing an avenue for more personalized interventions in the face of that heterogeneity is actually the beauty of the doctor-patient relationship. And I say this as someone who lives in Silicon Valley, but I still believe that doctors play a critical role and will continue to play a critical role in this field because it isn't a genetic test. And we cannot bucket patients so easily, and because symptoms wax and wane with time. So I really believe actually there's been a change of heart in the Valley across all of health IT about what used to be an allergy against IT-enabled service companies, and from purely a financial perspective, it is a lower margin business, and so it is harder to get a gigantic Facebook-like multiple on those companies. But the truth is you end up paying for it some way. You either end up paying for it on the front end, you end up paying for it in implementation, you end up paying for it in customer support, customer success. And I think everyone who's been in this business for at least 5 to 7 years have come to realize that the hype cycle on pure product is really hard in behavioral and mental health. So I think that my thought is there's actually much more an openness of IT-enabled service companies, and the question is how do you scale it? Anyone else tips?
I'd say 3 things. I'd say 1, follow the money. Got to be really clear in this day and age where the financial incentives lie, and getting people to do things either where they don't get paid or the financial incentives lie elsewhere is really difficult to do. I'd say 2 is pay attention to the workflow. Getting people to change behavior, particularly providers, to change behavior is really, really challenging. And there are a lot of cautionary tales that to be told about that. And I think
Those are good.
No, I know. I had one more. But
I like those. So we'll chime in any point that comes back.
It's tricky because people who live with these illnesses aren't demanding technology. The only technology that I've had demanded of me when I was doing homeless work was the use of an air conditioner. I've yet to find a technology that has beaten the experience of that human being when I got my company to pay for an air conditioner for her. She had a marginal apartment on the 6th floor of a crappy walk-up when she was pregnant, and it was summertime in New England, and you think it's unpleasant today in the 50s and rainy? It can get to 115 degrees in August on the dog day. So to me, she wanted something, right? She wanted a thing. And I've never had a person say, I need a smartphone to tell me, this or that. That's not where people are at. Now, I understand the whole Apple model, that to give people things they don't want. But in mental health, you ask people what they want, and then you try to be in service to them. So I would really encourage you, like the kind of work Justin's doing a project with people and learning from what they actually want, I think is the best way to go. Because delivering things to people, I'll just use one of Robert's cautionary tales. So ZocDoc is this amazing thing which is open table for mental health appointments as it is for medical appointments. Well, guess what? It works on the medical side, doesn't really work on the mental health side. You pitch it to professionals in the mental health space, and they're like, yeah, no, I don't want to do open table. I want to run my own time. I want to take private patients cash if I get a choice. I want to do softball coaching on a whim on a Tuesday. I'm not giving any of my autonomy up. It was very interesting. It seemed like a genius idea. And it's probably working great on the medical side. I'm not dismissive of this company. It's a great idea. But it's interesting. If you ask the providers in the mental health space, you would learn within about 10 minutes this is a non-starter for them, because all it means to them is loss of autonomy. None of them are hanging around reading the New Yorkers because the patients aren't coming. Right? The New Yorkers are in the waiting room. The patients are waiting. The demand is huge. It takes 6 months to see a psychiatrist in some systems, 6 weeks in other systems. And if you were willing to pay $350, it might take you 6 days. But there's still a wait. The demand's grossly. So thinking about solutions, you have to go back to the user, right? It seems to me, and this is something I've just observed hasn't always happened. So it's the air conditioner test. It's still my best technology, so when I come back in 2 years, you can tell me you've beaten the air conditioner test. Something technology that actually changed a person's life.
Yeah, I mean, I think just to kind of follow on that, I mean, I think really investing in your user, like literally having partnerships with healthcare, if you're creating products that are really intended to jointly design your products, not just to kind of test it once you have it, but really like try to find partners, because I think like what Ken is saying, you have people who are working in healthcare or running a group home or whatever who there's no one who's coming to them asking them what they need necessarily. They work within whatever medical record system or sometimes no medical record system, but I think those can be, you know, a catalyzer for any kind of product, whereas I think if you design products, do as best you can without those people, bring it to them, you're going to waste a lot of time and money. I think you want to get in much earlier, build patient advisory boards. That's like the first step you do. You know, like have partners that you can find a hospital, find a mental health clinic or something that you can really like bring into that process really early on, because it's not going to be one of these waterfall designs. It's going to have to be like agile design, testing your user at every iteration. If you're designing, you know, a tech product. And there's the other point I would say. You may find that your user doesn't want a healthcare product. What they want is like their iPhone to work better, or they want something else. They want something that's really more like a productivity tool, you know. And I think that's fine. I think the vast majority of products that I see being marketed as mental health products, they would probably do much better not in the healthcare space. They're just something that would be great productivity tools. What I would say is, you know, Slack is like my favorite mental health care product, right? Because it keeps you organized, keeps you communicating with your team, especially. So I think broadly about what constitutes a mental health care tool, because we all use them, we all carry them around.
Yeah. And I'll just say in one of our companies that we invested, there's always surprises. To your point of really invest in the consumer and the end user and in their journey. We invested in a company that is called Chrono. It's actually a pharmaceutical company. It takes nicotine and it gets to be delivered through the skin on a very specific interval. And I'll say for Canaan, for our fund, the real aha moment that we thought, oh, maybe there's something there, was turns out that about 80 to 90% of people who smoke and are trying to quit smoking smoke within the first 30 minutes that they wake up. And it turns out that that's a chemical issue. It turns out after you've been sleeping, it turns out you haven't been smoking. And it turns out the amount of nicotine in your blood is like really low. It's actually, for the pharmacologist in the room, it's the lowest point of your blood levels. It's your PKC-min. And what blew me away was essentially we have to find a way to dose people with nicotine before they wake up. And then we need to like let them know that they got their hit. I mean, it's like a crazy wild thing. And it turns out people smoke after they eat, and when you eat, you metabolize nicotine, and then you get a craving. Real weird. So it's this moment that there's a psychological effect of like doing this, and we gotta figure out how to solve that. But there is a huge issue of if I can get a drug administered that you can't take before bed because you'll be up all night and super wired, it's a stimulant, but we get it on board on a patient in the morning, we actually can make a really huge difference to patients by addressing cravings and addressing the psychological effect that I need my hit. And so I think sometimes there are these moments that surprise you, and they create these opportunities for companies that could make a big impact on someone with a small observation.